ऑपरेशन ट्रॉली मारा.
ಸೀಸರ್ ಹಿಸ್ಟ್ರಿ ಐತೆ
So good evening guys. Today we will discuss about some of the problems of intubated patients. In ICU during duty we have observed there are some patients we already intubated them. So after the intubation there are some problems of the patient. So what are the problems? We will discuss some symptoms and the possible causes of that problem. So first is if the patient, any of the patient we have intubated, so after intubation there may be a good saturation, tachypnea should be reduced and saturation should shows normal and patient condition should improve. So we have instead of these things, if the patient is having problem of the intubated, if the, even of that after putting some ET into ET there may be problems. So we will discuss these problems because these problems are very important. So in this video, we have already seen this previously video. There are sources of one patient is sweating, one more patient is he will be tachypneic and he will be become very his respiration rate is high. So what you have to think is we'll discuss some symptoms and causes. So first is sweating. So if the intubated patient suddenly started sweating, what are the causes of that sweating is if the intubated patient if it is sweating means first you have to rule out the hypoglycemia. So intubated patient he is not taking proper oral anything. So one more thing, if the patient is having same diabetic patient, if someone given more insulin, that may be cause of hypoglycemia. So that we have to do, that we have to check first. If you are saying that patient is sweating, and first immediately we have to check for the sugar. If RBSL, like random blood sugar is low, that is hypoglycemia. So we have to treat that. The patient problem will be closed. One more thing is sweating is there may be blockage. So what are the blockages? Like ET blockages there may be cause sweating. How it will cause sweating? We are putting ET because the patient is having already compromised airway. So that we have put ET. There may be because of more secretion ET. If ET blockage is there means patient will suddenly have some breathlessness. Patient will tachypnea and after the patient will feel sweating. So this is the condition. But there are some patient even after blocking ET also they will not have sudden breathlessness and desaturation. They will only have sweating. So what it indicates is there may be a half blockage of the ET. So even like half blockage of the ET is there or full whatever. So patient will develop huge sweating. So sweating is only have to two things: hypoglycemia. One more thing is we have to see for the ET blockage. We have to put suction in that and we have to see for that. And one more, only third and rare is suddenly some patient will have suddenly embolism may be happen. After embolism patient will have tachypnea and sweating and it's MI. So this is things to be ruled out. ECG should be taken, RBSL should be checked and once you have to see for the blockage of the ET. This is sweating. Second symptom is if the patient suddenly hyperventilating. So what is meant by hyperventilation? Patient respiration, the patient will suddenly, this is a hyperventilation, suddenly they will start more respiration rate. So what you have to suspect is in this patient, this is very important. Monitor is showing normal saturation and patient is tachypneic, like suddenly he is taking hyperventilation. What you have to suspect? We usually what you think, patient is having breathlessness, tachypnea, there may be desaturation, there may be blockage. So this is not the same for every case. So there may be possibility as a hypocalcemia. There may be because if the patient is alcoholic and he got an encephalopathy, we intubated. A patient may develop hypocalcemia. Because of hypocalcemia, patient will develop some hyperventilation symptoms with tetanus and the carpopedal spasm may be there. If the carpopedal spasm and sudden tetany and sudden hyperventilation, we have to see for the hypocalcemia. We will send serum electrolytes and calcium levels. We will diagnose that. One more thing is you have to send for the ABG. So ABG is if the patient is suddenly hyperventilation, intubated patient hyperventilation, you have to send ABG. ABG there may be a pH low level. There may be a metabolic acidosis symptoms may be there. Because of this acidosis, there may be tachypnea or hyperventilation. This is second cause. One more cause is patient really having some blockage. If it is blockage with the tachycardia, there is monitor will show some reduced saturation. If the patient, just imagine patient is there, he is having suddenly tachypnea, respiration rate is more, and if we are seeing that saturation is reducing, so this is direct indication that patient may have some blockage. We have to change the ET. This is one thing. and ABG in this like hyperventilation, tachypnea, ABG, and some other causes metabolic acidosis to be rolled out. This is one. First we'll discussed already sweating, hyperventilation, breathlessness. So breathlessness is very important. If the patient is having intubated, for the same patient we have intubated, again then after intubation patient suddenly start breathlessness, not a tachypnea, more heart rate, maybe heart rate even of like, see, if the patient we have intubated, heart rate like respiration rate is more than 30, that is also danger sign, because maybe a small amount of blockage may be there, that you have to see every time. You have to see for the good chest expansion, and you have to see for the saturation, and you have to see for the breathlessness, and you have to see for some, you have to observe like good airway is there, airway air entry is there or not, that you have to see. So sweating, hyperventilation, breathlessness, and some like patient in other cases like hemotoxic, not neurotoxic snake bite, they will suddenly patient will have breathlessness, suddenly patient will have some dysphagia. We have intubated to save them. After intubation we have given some AHV and everything. After when they will come out of the venous action, patient will be normal. When patient will be normal, they will be violent, like they want to remove that. So even after like before this is violent, patient is violent, patient is conscious, and how to assess the consciousness in the patient of intubated. So we have to ask them, we have to ask them to pull hand, we have to ask them to take legs to their side. So we have to tell them any active movements they are observing, like if they are oriented to place, person, time, and they are oriented to our actions, that have to be, that in that patient that ET should be removed, because patient is came out of the danger. So this is one factor. One more suddenly thing is desaturation. See, if the patient is having intubated, suddenly there, even after intubation, saturation should come around 95, above 95, except COPD, except bronchial asthma, emphysema. In these conditions, saturation even after giving intubation, even after giving huge oxygen, saturation may be low. But in other than these conditions, saturation should come above 95 after intubation. So if the patient is having 90, we should not neglect that saturation is 90, we have to skip. We have to take lightly. No, this is not. You have to accept, other than COPD, asthma and emphysema, other conditions should maintain saturation more than 95. So these all things to be keep in mind. So this is, I think we have seen this video. This is a very important presentation, I think, because even intubation is not only a best action. So what you have to do, we have to think some complications and some problems of the intubated patient. So sweating is a danger sign, hyperventilation is a danger sign, breathlessness is a danger sign, and one more thing is violent is also danger sign, and desaturation is also danger sign. So these things to be keep in mind. Okay, thank you.